Coming to you from beautiful downtown Las Vegas and our brand new offices at 6th and Charleston, I'm Glenn Truitt, the managing partner of Ideal Business Partners, and this is your Healthcare Minute for November 29th, 2017. Unless you've been too caught up in politics to notice, the healthcare industry is in the midst of unprecedented consolidation. Private acquisitions have given way to private equity acquisitions. Joint ventures have given way to mergers, and mergers have given way to mega mergers. But just when things were getting really big and what some saw as a hedge against increased uncertainty in government healthcare policy, the federal government has thrown cold water on this fiery market. In February, a federal judge blocked a proposed $48 billion merger between Anthem and Cigna, and in late June, Walgreens and Rite Aid called off their long-anticipated merger after federal antitrust officials indicated the deal would likely not be approved. It turns out the sky wasn't the limit after all. However, there are still, as always, economies of scale to recognize, even if all the benefits can't be recognized by the companies making the move to leverage them. Disruption agents have already started sniffing around the edges of healthcare, including Amazon's interest in pharmacy and tech companies offering virtual healthcare via computer and or cell phone. As a result, many companies that were once at odds are entering into surprising and unexpected joint ventures. Two important examples are Aetna, who is currently in talks to combine with CVS Health, and the Cleveland Clinic, one of the most highly rated health systems in the country, who has joined forces with Oscar Health to offer individual health plans in Ohio. Companies like these are actively looking for partners that will provide access to new businesses or a new supply of customers. CVS Health, which, as you know, many of you know, started as a drugstore chain, operates a large pharmacy benefit manager as well as walk-in clinics in its drugstores. By combining with Aetna, which covers about 22 million people, CVS will be able to direct members to its own mail order and pharmacy businesses, as well as its walk-in clinics located in the drugstores for much of their care. As partnerships between insurers and large group practices become more and more common, patient choice will become increasingly more limited, and the opportunities for independent practices to distinguish themselves with unique service offerings and high-touch customer services will continue to grow. In fact, this new breed of consolidation, which seeks more and more contact with the end user, will expose these same patients to the real costs of consolidation in corporate medicine and drive increasing numbers of them towards private practices. However, private practices will similarly need to look for strategic partnerships on a market level to ensure they offer similar convenience, because as much as a patient may like his or her doctor, they're not going to walk a mile in the snow uphill both ways like their parents did to school just to avoid signing up at the new Aetna CVS on the corner by their house. If you have a great partnership you're interested in pursuing or just want to know how to keep up with all these changes, schedule a free consultation and tell us all about your practice. And you can still keep up with us at idealbusinesspartners.com or follow us on Twitter or Instagram at WeAreIBP. Together, let's lift your business.